Despite the rush to vaccinate, some Ontario pharmacists say half the people offered the Moderna vaccine have been refusing it. For more, I want to bring in Justin Bates. He's CEO of the Ontario Pharmacists Association. Hi, Justin.
Good evening. Thanks for having me on tonight.
Thank you for coming on a Friday night. So this is interesting. Can you explain, first of all, the protocol right now over which vaccines are available and how they are being allocated?
Well, there is a prioritization based on public health guidelines to allocate the Moderna vaccine for those that are 30 and over, and for the 18 to 29 age cohort to ration the remaining Pfizer. And there's not much left in the pharmacy channel for that cohort, largely due to the risk of, and it's a very low risk, but it is there for the inflammation of the heart or myocarditis. So we want to make sure that we follow those guidelines, and we are shifting most of the supply in the pharmacy channel over the next 2 weeks to Moderna.
Okay, so people hear that, though, that there's a slight risk of the myocarditis, and that's causing some concern, and they're literally walking away from a Moderna booster?
Yeah, I think there's two factors with respect to the vaccine hesitancy that we're experiencing with Moderna. And it really goes back to the early days of the rollout in March 2021, when Moderna had some supply challenges in the Canadian marketplace. And that means that the majority of people received a first and second dose of Pfizer. And there is some uncertainty in some individuals about mixing still. And I think there's a lot of education that pharmacists have to do and other healthcare providers to demonstrate that this is equal to Pfizer. It's safe, it's effective. And in fact, in the Omicron, we're showing data that is demonstrating that Moderna may even, in fact, have a higher efficacy. But there's the other factor, which is just, it's consumer awareness and perception. And that's very hard to change because people are familiar with the Pfizer brand and maybe less so about Moderna. So it comes down to education and really addressing some of the concerns that are out there.
That's a great point. But, you know, as pharmacists, they are so overwhelmed right now and overworked and in high demand, and it's a lot to ask of them to, you know, add that to their plate. I know it's part of their job to explain to customers and clients and patients the pros and cons of certain drugs, but how are they managing? Has there been sort of a directive that's gone out to help them get across the message that you're advocating tonight?
Yeah, we have key messages and lots of information to be able to share. And you're quite right. Across the healthcare system, there are labor shortages, both due to the labor pool, but also due to infection. So we have a number of pharmacy professionals that have to isolate due to the spread of Omicron, particularly at this time period that we're dealing with. But part of this is also, understanding that when you get a flu shot, most people, and I would probably hazard to guess over 95% of people, wouldn't know who the brand manufacturer is. So we've got stuck on these names rather than understanding that an mRNA vaccine equals an mRNA vaccine. Whether you're mixing them or not, that's the key message. And getting a vaccine now versus waiting or vaccine shopping is much more effective in providing the greatest and maximum immunity against Omicron and the spread of it as well. So we keep encouraging people to be essentially ignore the brands and get the vaccine that's available to you when it's available.
That's a great point. I appreciate you coming on tonight, Justin. Thanks again.
Thank you.
Okay, Justin Bates, CEO of the Ontario Pharmacists Association.